Dr. Shluper, I want to talk to you about periodontal disease, gum disease, gingivitis, all the same thing, just a little bit, different stages. One is more severe than another one. And here's what I constantly hear. Dentists are advocating that if you do not fix your periodontal disease, you are going to lose all your teeth. Now, bad thing, absolutely, and you mentioned in some other videos that, while implants are a wonderful thing, at the same token, they do create a foreign body, something which is, that has nothing to do with the implant failing. The implant is perfect, everything is fine, but our bodies are not made to have foreign thing in our body, and then that is toxin on the liver or on the kidney, I think you said. So in any case, so losing teeth is bad because it triggers a whole lots of things. However, here's my opinion on it, and you tell me how wrong I am or how right I am, and you give us your 2 cents, please, if you don't mind. While you're losing all those teeth, which may take 2, 3, 5, 6 years, whatever, a while, doesn't go overnight, right?
Mm-hmm. Right.
Yeah. While you're losing them, you're literally poisoning your body. Your mouth, the gateway of the blood vessels, where, when a person is unconscious and you put some, whatever drops under the tongue and he goes, ooh, I'm here again. So that means it goes into the blood right away. And that's the very point where you have your infection, your yellow, reddish, ugly pus. And it drips into your blood, it goes to your kidney, it goes to your liver, it goes to your stomach. In fact, it goes to your stomach both ways. You have it nice there, you chew your food, it gets nicely mixed up with that yellow pus, and right down it goes. And of course it goes down into the blood, it gives heart attack, it gives strokes, it brings your immune system down. I have heard that women who have gum disease have a tendency to get premature born babies, which are then underweight. So those problems, to me, look a lot worse than having no teeth, because at least teeth can be replaced. But this type of stuff, how do you replace your liver, your kidney, your basic blood? How do you do that? What price can you put on your immune system when the next swine flu, bird flu, never mind the swine flu, bird flu, the next flu season comes? How way off am I here?
No, you're absolutely right. The mouth is the gateway to our body. The microbes that are constantly located in our mouth, they are invading into the bloodstream. We do need mechanically to remove them from around the teeth. That's the location where they are. Add to that the cavities that they are located in them, or the restoration that are inside of our mouth. Around the restoration, it is a perfect site for the microbes to live. They get plenty of food, they have perfect condition. A person by himself may not be aware of their existence. He doesn't feel it. It doesn't bother him. He only will feel it once he will become ill because of them.
And he can become ill. Tell me, can he become ill in his liver, in his kidney, in his heart, literally in his brain? Can his immune system go so far down that he, can get an everyday cold much, much faster? Is it true that stillborn babies in California have been born, and definitely lots of underweight babies are born across the United States? Can he get that type of illness? Is that the type of illness you're confirming here, or not?
Yes, it's pretty much makes sense. Somehow I hear that all the illnesses around dentistry located in California.
Well, all good things come from California. All good things come from California.
Every problem that dentistry started in California somehow.
Well, that's not true. That's not true, because there was an AIDS case in Florida in 1990, which apparently came from a dentist. Never completely proven, but nevertheless. So I gotta give the other guys some credit too.
in California, they is supposed to sign the patient about using amalgam. Most likely, Californians are more aware of dental disease, which is good. I encourage that. As far as the periodontal problem, people do not normally aware or taking care of their gums. It doesn't hurt as much as the nerves that are inside of the teeth.
Right.
It takes longer to treat the periodontal disease. So it's a very slow disease, and it constantly continues. So the only, I wouldn't say the only, but the best way to treat it is being aware of it. Have your exam and cleaning periodically. It is recommended for every person to have the cleaning every 6 months. It's not set in stone that every 6 months you should have it, but it is the recommended time. I would say between 6 to 9 months, every person should have a professional cleaning, at least the evaluation of it.
Mm-hmm. Right. Well, let's go back to, obviously that's a way to prevent it. But what we need to get across here, what I want to, get my own confirmation here is about the severity of this illness. So would you agree, you obviously, it looks like you're agreeing that, yes, fixing those other illnesses, the lowered immune system and all that, is a very irreversible thing. It's very difficult to fix this once the kidney or the liver or whatever has been, damaged. Let me ask you this. Is it true that lately, in the last few years, more and more surgeons, regardless whether they do a hip surgery, a meniscus operation, or take out appendix or tonsils, that more and more of those surgeons keep asking the patient to go to the dentist before surgery and get a clean bill of oral health, because the surgeon says if you have any type of gum disease in your mouth, they don't care about a cavity necessarily, but a gum disease. If you have any type of gum disease in your mouth, I will not operate you because your body is predisposed, weakened. It's already weakened with the disease, and if I start cutting in a different part of the body, I might create major problem because your body can't stand 2 major injuries at one time. And of course my operation could get infected because obviously your infection from your mouth, it goes through the blood, and wherever I cut you, there'll be blood, and my operation can fail because of your one. And only lately has that become very heavy, imposed by the surgeons. Is that something you have noticed? Is that something you're aware of and is true?
Yes, absolutely. If you do some invasive procedure on a patient, any surgery, you would like to make sure that it won't get reinfected again. The teeth can cause infection that would spread through the body into the operation site. The operation site, as it is, it's prone to get infected.
Right.
It is already a scar tissue.
Right.
Blood runs into the operation site, and with the blood would come all the microbes from the mouth, and it would not allow it to heal properly.
Right. So if something so severe can happen, I really hope that the viewer of this video realize that if that type of severe stuff can happen, under premature babies, operations go bad because you have a gum disease, that it is just simply a wise thing to fix it, because you're just simply prone, as you simply put it, to be more ill and to be more fatigued, more exhausted, because any time the body has to fight an illness, an infection in your body, it gets weakened. There are only so many soldiers to to keep the body energetic.
Yes. The more severe the disease, like cancer, you would first treat your teeth because the treatment itself may require very strong medication, irradiation, if we're talking already about cancer, that would cause the teeth in the first place to get decayed. The irradiation, would cause decay of the teeth. We would like to prevent it before the treatment would start.
Right. So anyway, the teeth, the gum disease literally predisposes lots of illnesses. Let's just leave it at that. Thanks for your candidness. Thanks for explaining this to us and confirming that it's simply not good to have a gum disease. Besides of probably stinking and smelling up the room. Who the hell wants that?
Yes, thank you, Helmut.